Cardiopulmonary resuscitation, or CPR, is critical to saving the life of a cardiac arrest victim. The goal of CPR is to provide oxygenated blood flow to the brain to keep it alive and to the heart to increase the chance for successful defibrillation. Once the heart has stopped beating, the brain begins to die within 4 to 6 minutes due to a lack of oxygen. External chest compressions and rescue breaths can provide enough oxygen to keep the brain alive until professional rescuers arrive. In order for CPR to be effective, proper chest compressions are essential. There are 4 key elements of good chest compressions: press firm, press fast, decrease interruptions, allow full recoil of the chest. So first, press firm. Many people fear compressing the chest too hard, but studies have shown that most people actually don't press hard enough. External chest compressions squeeze the heart between the sternum and the spine, forcing blood out of the heart. If compressions are too shallow, blood flow is inadequate and CPR is not effective. Compress the chest firmly enough to create adequate blood flow. Firm compression is not enough on its own. You must also press fast. Now this illustration depicts a heart that is being compressed too slowly and producing very little blood flow. As we increase the compression rate to 100 times per minute, the blood flow also increases. It is also critical to keep interruptions to compressions at a minimum, with the exception of during rescue breaths. Each interruption slows the circulating blood, depriving the brain and the heart of oxygen. Finally, make sure there is full recoil of the chest between each compression. Without full recoil, the heart will not completely refill with blood between compressions and the blood flow produced by CPR is reduced. Let's do a quick review. Press firm, meaning adequate depth. Press fast, around 100 compressions per minute. Decrease interruptions to keep the blood flowing and the brain and heart oxygenated. Allow for full chest recoil between each compression. Keep these critical chest compression techniques in mind as we learn the ABCDs. Now let's look at the ABCDs. The ABCDs are a series of actions to take when you find an unresponsive victim. They will help you quickly assess and treat immediate life-threatening conditions. You find a co-worker lying on the floor. What do? The first step is to try to establish a response by tapping and shouting at the victim. If the victim is unresponsive, then send a bystander to call 911, get an AED, and hurry back. If you are alone, you must call 911 immediately, then return to the victim as quickly as possible. After the EMS has been activated, it's time to do the ABCDs.
Thanks for volunteering, James. Let's remember that we've already established the scene is safe. Our gloves are on, and our patient is unresponsive. We've had a bystander call 911. Now we're ready for the ABCDs. A, for airway. The victim will die without an open airway. In an unresponsive victim, the most common cause of airway obstruction is their own tongue. This is why our first step is to tilt the head back and lift the chin. Place one hand on the forehead. Use slight pressure to tilt the head back. With the other hand, place 2 or 3 fingers on the bony part of the jaw and lift the chin. This position prevents the tongue from blocking the airway. Now we address B for breathing. While maintaining the open airway position, place your ear directly over the victim's mouth while watching their chest. Look, listen, and feel for the flow of air for at least 5 seconds, but no more than 10. If the breathing is normal, C, compression, and D, defibrillation, are not needed. Maintain an open airway and move on to S, control any severe bleeding and treat for shock. Obviously, James here is breathing and has no severe wounds. However, this is not the safest position. Since he is unresponsive, his tongue may obstruct his airway or he may vomit and choke. That's why unresponsive victims who are breathing normally are placed in what we call the recovery position. We use the log roll technique to move the patient safely. First, place the victim's arm out to the side, grab the hip and shoulder, and roll the victim towards you onto his side. Bend the knee for support, and make sure the airway is open. This is the recovery position. His airway is open, and I can monitor his breathing. Was that clear? Are there any questions?
Does it matter what side you roll him onto?
In general, it doesn't matter, other than in the case of a pregnant woman, who should always be placed on her left side. Or someone who's had a stroke should always be placed on their affected side.
So what if they're not breathing?
Good question. Thank you, James. Let's talk about rescue breathing and chest compressions. If an adult victim is not breathing normally, pinch the nose and give 2 rescue breaths for 1 second each. Just enough air to make the chest rise. Overinflation interrupts compression and can cause vomiting. It's best to use a CPR barrier device to prevent exposure during rescue breathing. Keep the airway open and create a seal. Immediately after the rescue breaths, begin chest compressions. To do this, first open the shirt and place the heel of one hand on the lower half of the sternum between the nipples. Place the other hand on the top and interlace your fingers. Keep your elbows straight and your shoulders directly above your hands. Compress the chest 30 times at a rate of 100 compressions per minute. Each compression should be at least 1.5 to 2 inches deep. Allow the chest to fully recoil. If we compress 2 inches down, we allow 2 inches to recoil. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. D is for defibrillation. Allow the use of an AED as soon as it's possible.